Welcome to Delaware Healthcare Reality, a podcast presentation of the Medical Society of Delaware with Dr. Nicholas Biasotto. Dr. Biasotto is board certified in family medicine, and he has extensive experience and training in treating patients with addiction and substance abuse. Now, let's join Dr. Nick Biasotto for Delaware Healthcare Reality.
Hi, I'm Nick Biasotto. I'm a physician from the Medical Society of Delaware and host for your podcast, Delaware Healthcare Reality. Today we have a special guest, Eric Hansen. He's a Republican candidate for U.S. Senate. Eric Hansen, raised in Florida, found faith at an early age and worked his way through college, eventually earning his master's degree from Yale School of Management. His success, built on perseverance in education, has driven him to advocate for improving schools in Delaware and nationwide. He believes education is a key to achieving the American dream, which he sees as increasingly out of the reach due to failing schools and financial strain on families. Eric has a background in corporate leadership with roles at companies like Procter & Gamble, Johnson & Johnson, and Walmart. At Walmart, his work on affordable private label brands saved consumers over $25 billion, putting real money back in people's pockets. Frustrated with the lack of progress in Delaware and by politicians failing to address key issues, Eric is now running for the United States Senate to lower taxes and costs for working families. Eric has been married to his wife Susan for 17 years, and they have 2 children attending public school in Delaware. Welcome, Mr. Hansen. Mind if I call you Eric?
Not at all. Thank you for having me.
Anything you want to add, subtract, multiply, or divide on your bio?
No. The one thing I would say is I consider myself a reasonable Republican that really wants to work with reasonable Democrats to get some real results out of D.C.
Gotcha. What made you move into a political realm? Have you ever been in politics before in any way, shape, or form?
Now, never been in politics before. In fact, I'm a proud non-politician. I think a lot of the problems we have in the country right now are because of politicians and the system. And I ultimately got into politics for 2 reasons. One is that when I was at Walmart, I was saving shoppers $25 billion, saving people so much money with really good products that were half the cost of the national brands. And I had, as an example, one woman said, "Eric, because of the work that you're doing, I can finally afford to buy formula and diapers for my child." And that makes you feel incredible that you're changing people's lives for the better. Mm-hmm. No job I've had before Walmart and no job I've had after. Some great jobs as an executive since then, too. None have made me feel good about myself in the way that saving people so much money and changing their lives for the better made me feel at Walmart. My hope is that as a U.S. Senator, I can do that for the country. Give back. Make everyone's lives better. The other piece is we landed in Delaware a number of years ago, put our kids in public school, and love Delaware. We love the beaches. We love the farmland. We love our home. We love the Rollins. It's a jewel. Mm-hmm. Close to Philadelphia, close to D.C., close to New York. It's close to everything. Mm-hmm. It's a wonderful place. We started seeing some of the chinks in the armor when we put our kids in public school. And that's when we started seeing that Delaware, with all its wonderful potential, has got a lot of things to fix. And so between the fact that at Walmart I had an existential awakening in the desire to do more and to give back, and then saw how much potential Delaware has to get better, those 2 things merged together to say, you know what, you got to do more, and doing more could be the U.S. Senate.
Very good. Well, term limits we'll start with. I understand you're in favor of term limits, and your intention is to serve 1 term, possibly 2. Can you accomplish what you want to do in that period of time?
So the system right now is really broken, and what we have is politicians who care far more about getting reelected than getting results for the people that they represent. And they're afraid to cross the aisle because they're afraid they'll be punished for it. They're afraid of being bold in their votes because they're afraid it's going to come back to haunt them in the next election cycle. And in addition, we've also got incumbents that have tremendous advantages so that there's a real ability for them to stay in office forever. So we have career politicians, and that's a problem right now, I think. What I've said is I want to be a single-term single-term thinker, and I'll vote and think like a single-term candidate. If the majority of Delawareans think I'm doing a fantastic job, I would consider running for a second term. But I don't want to be constrained by this mentality that I need to get reelected. So the idea of being a single-term candidate frees me to vote for what's right and not to vote for what I think will get me reelected, which is a lot of the problem with politics right now. We've got establishment politicians, again, care about getting reelected. We don't have enough new blood, enough new ideas. So this will really help. If there's nothing else we do, I think this is the one thing I'm going to push for that would have the biggest change in our political system. Term limits across the boards for everyone, but I certainly agree to them right up front.
Okay, thank you. Now I'd like to move on to the economy. As you know, we live in hard economic times. The cost of living has risen. We have a substantial debt, and we suffer the pangs of inflation. Can you discuss how you would remedy these concerns, and can you tie fossil fuel harvesting as a means of increasing our nation's income now and await advances in solar, wind, electric, and nuclear energy to the future? How do you rein in government spending, which is presently and seemingly off the charts?
Yeah, so it's a great question, and there's a lot to unpack there. I think that the two biggest parts of your question are about the cost of living and about the economy in general and spending, and the other piece is about energy. So let me answer both of those.
Okay.
So with respect to cost of living, absolutely, it is way too high. People are spending too much money on healthcare, on housing, rent, on food, all of utilities. All of these expenses are really straining the average family in Delaware. 60% of Delawareans are living paycheck to paycheck. It's really unsustainable. So the fundamental problem we have as a nation is we've got a spending problem in the U.S. We don't know how to rein back in spending. And Congress spends as if they aren't spending their own money and as if they're spending just to get reelected, which is probably the case. So the challenge that we have as a result of that is we as a government, federal government, waste about $1 trillion a year. Tremendous amount of waste. If we could shift that spending into programs that really work better, things would be so much better. But the government's not going to do that on their own. And Congress doesn't have the will and the leadership to rein ourselves in and to be fiscally responsible. So what I'd like to do is propose the Hansen Tax and Spend Reduction Act. And what that would do is it would, through attrition and a small reduction in spend, it would force the government to reduce spending by 2% every year. What that would do is just naturally cause the government to start spending more efficiently and more effectively on the programs that really do the best and stop spending on the programs that waste money. So that would be a tremendous benefit for the country. The other thing that you asked about was energy, and I completely agree with that as well, which is right now the way we're thinking about energy is in terms of regulations and mandates, and I think regulations and mandates aren't the solution. The solution is innovation. Innovation gave us 100 years more natural gas and allowed us to transition away from coal to natural gas-fired plants and reduce the greenhouse gases in this country by 30%. Tremendous success. Innovation is allowing solar prices to drop dramatically. Now, unfortunately, China is producing all those solar cells, so we got to get that back here in the U.S. But ultimately, the solution is innovation. And what I want to see happen is I want to see the regulations go away, the mandates go away. For example, the EV mandate, that's not good for anyone. Why should you be telling someone they have to drive an EV when for many people it's unaffordable or it's just not practical? The regulations aren't the solution. It's the innovation. So let's get back to innovations around small modular nuclear. Let's get back to innovations around geothermal. Solar's already doing fantastic things that have decreased cost. And let's make sure that we, the United States, are driving and producing those as well, and not just China.
Well, if we do decrease in fossil fuels and the greenhouse gas effect, which in turn is supposedly causing global warming, though the Earth does go through cycles of warming, how do we get other countries, which are really not paying much attention to the green ideal, such as China and India, where they're really off the wall when it comes to fossil fuel emissions. How do we get them to come around and help the Earth?
Yeah. So the answer, you're exactly right. China and India are so reliant on coal which is a very dirty, not put greenhouse gases aside, it's a very dirty process. So China and India are addicted to coal and are growing coal at such a fast rate that we cannot offset by that by any reductions here in the U.S. So anything that we do here in the U.S. is totally negated by China and India. The answer is that we need to have tariffs on heavy energy used products. So, for example, glass or aluminum use tremendous amounts of energy. And China and India right now are using coal to generate those products. If we have a tariff that says if you use coal-fired plants to generate energy for those products, we're going to tariff them. Mm-hmm. That will disincentivize China and India from using coal-fired plants and move them away from that into natural gas, which we could export, which would be tremendous for us. I love the idea of us moving from energy dependence a few decades ago to energy independent now to a future of energy exporting. Mm-hmm. Liquid natural gas is a great example. Would love China to shift from coal-fired plants to U.S. natural gas-fired plants. That would be fantastic.
Okay, understand. Very good. Let's move on to immigration. Our border is broken, and immigration or migration into the United States under the present administration has left us vulnerable. What solutions would you support to, one, be more selective on who comes in, and are there barriers that should be established, such as the so-called wall?
Yeah, so great question. And in my mind, some of these questions are relatively simple. In my mind, legal immigration is good, and I fully support it. Illegal immigration is bad, and we need to end it. And that's the principle that we should always think about, is legal good, illegal bad. We've got 11 million illegal immigrants already in this country. We've got 600,000 immigrants roughly every year coming into this country. It's unsustainable right now. So we need to do a number of things. I agree with you entirely. The quality of the people coming in this country should be improved, and skills-based immigration should be part of that process. The other thing that we have to do is reform the asylum rules. The asylum rules right now basically mean I cross the border and I'm here forever. I've got a court date in 3 years. If I show up at the court date or not, I'm still here forever. So there's nothing preventing people from staying. And then there's nothing dissuading people from coming. They want to come here to live the American dream. I get that. But we can't let everyone from South America come here to the United States. It's just not practical. So what can we do to create penalties for those that come and create costs for those who are already here illegally?
How about those that are illegally here now? Over 10 million people have supposedly come through the border. Some have been vetted and some have been not. The border authorities are overwhelmed. The ones that have gotten in, do we even know where they're at? Are you in favor of deportation? Are you in favor of further vetting before deportation? Or just leaving it be and giving amnesty to everyone?
Yeah. So amnesty is not going to work at all. First of all, it's not practical. And second of all, it's not fair to all the people who spent years and lots of dollars and painstakingly went through all the right rules and jumped through all the hurdles to be here legally. Completely unfair. I can understand why the legal immigrants who did all that work would be offended by the illegal immigrants who are potentially given amnesty. Not an option in my mind. Mm-hmm. So I agree with you. Yes, we need to do a far better job vetting. We need to do a better job with the asylum rule reform. We need to do a better job potentially even creating some walls, unfortunately, to keep people from coming in. We have to have the disincentives. But we have a whole lot of things that we have to do to reduce this problem, ultimately.
My family came from Italy. My grandfather came by himself first. He was a master carpenter. He worked on buildings in New York City. He gradually assimilated, gotten enough money to bring the rest of the family over, and overcame my parents and my uncles and everybody else. But they did it the right way, and they did it through the immigration system that was already established. And at that time, trachoma, which is a bad eye disease, was screened on initially coming in the United States, and you were quarantined if that was the case. I don't think we've done anything to check the health status of the individuals coming across the country at this time, which is kind of scary because in America we've had control of measles, mumps, rubella, and things like that through adequate immunization, which other countries have not done. And I think we're exposing our people to more diseases that we have supposedly almost eradicated in the U.S. Okay.
And I completely agree. That terrifies me. MMR, polio, there's a lot of... And then there's not just the diseases. There's the... Are we letting in terrorists? Are we letting in gangs? Are we letting in drug dealers? We do not have control of the flow of people across the border. We are not vetting appropriately, and therefore we don't know who's here.
That's bad. All right, let's move on to healthcare, because I think we could talk about immigration for an hour in just itself, but let's move on to healthcare, which is close to my heart, being a physician. Our medical system is broken. At present, doctors are retiring earlier than usual. Some are seeking new vocations outside of medicine, and primary care physicians are becoming few and far between. Doctor burnout is a real issue. Can you save the foundation of medical care by helping primary care thrive in this climate? Is the answer a one-party payer system, limiting the hassles of dealing with so many insurers, or with so many variations to their plans?
Yeah, so my time campaigning, I've run across lots of doctors all across the state that I've talked to, and what I hear kind of consistently among primary care physicians is the same story. Something like, my Medicare reimbursement rates have gone down by 20%, and my costs have gone up, and I don't know how I'm going to survive. And the reality is right now we don't have a single payer system, but we do essentially have a single pricer system where Medicaid and Medicare set the rates of reimbursement and the entire marketplace follows. And so the government is already essentially setting the price for healthcare delivery. And it's putting enormous pressure on primary care physicians and across the entire healthcare spectrum. But primary care physicians I have enormous respect for, because they're the ones who, out of the entire healthcare supply chain, they're probably the most vulnerable. And they're underappreciated and underpaid to begin with, and this situation makes it even worse. And in addition, we've got a supply and demand problem. In a normal economy, we have a supply of primary care physicians that's too low and a demand that's too high. So in a normal situation, the cost of those services would go up, and it would just rectify itself naturally. But the government is controlling the pricing. And what happens? As a result, it chases even more primary care physicians out. So you're exactly right. This is a fundamental problem we have to solve. And the government is not the solution. Government's already part of the problem. Making the government more of the problem would not be the solution. It's, I think, the most complex question we have on any of our plates right now, collectively. And I wish I had a simple solution like I do for immigration, where it's, legal immigration good, illegal immigration bad. I wish it was that simple. Unfortunately, it isn't. There's a couple things that I would like to explore, and I would love anyone in the medical community to give me more ideas. But one thing I'd love to explore is this idea of pay for moving from fee-for-service to outcomes-based systems. So very different than what we do right now. But there's not an incentive then to have lots of services, which then put additional pressure on hospitals and primary care physicians, but then move to rewarding everyone in the healthcare community for getting to the right outcomes. That could be a game changer. We're not there yet in terms of even testing it, but it's got a lot of promise. Another thing that I think we have to do is we have to look at Medicare pricing through the lens of a doctor and what are the implications to them. And that would change the way we price and reimburse Medicare and Medicaid services in a very different way, and might relieve a lot of the pressure for the entire healthcare community.
We're due right now for a 2.8% reduction this year, coming up for a vote. All the doctors and every medical societies and the AMA and the AOA have said this can't be. We can't keep doing this. Our payments have not even keeping up with inflation. When I first started practice 44 years ago, 70% of the docs out there were solo practitioners, like myself. I still am a solo practitioner. I've managed to survive. But it has put a big strain on us. Most of the doctors are going into hospital-based practices. A lot of restrictions there. I guess it's all due to regulations in the hospital setting. You'll see very few primary care doctors. Our producer, Tom Minton, has had a problem finding a primary care doctor because they're few and far between. My personal belief, being a primary care physician, is we are the foundation of medicine. from which we can then get consultations with the cardiologist, the endocrinologist, or whoever. But we know what's wrong with the patient, and if we need help, we ask for it. Interesting how things are going. I hope that changes in the near future.
It has to. I agree with you.
Okay. No, that's good to hear. Our next subject is education. We have some of the best educational opportunities compared to many other developed countries, yet we fare poorly in academics. It is sad that many of our high school graduates cannot read or write at level and are not capable of simple math. Why do you believe this has occurred, and what would you do to remedy the problem? Should we have school choice, which would allow parents to use tax dollars going to public education to enroll their children in private schools, which seem to have better outcomes on standardized testings?
Yeah, so what I can tell you is the answer is not simply more money. So there was recently a study done by the Delaware legislature that said that we should invest another $800 million in education here in Delaware. We are already number 5 in spending and number 46 in outcomes, on the way to number 50 in the next 3 years. Massachusetts spends as much as us, and they're number 1. It's not a money problem. Just as another example of that, we spend about $22,000 per year per student in Delaware as a whole. There's a school in Wilmington where we spend $32,000 a year per student. The teacher-to-student ratio is 9 students for every 1 teacher, so the ratio is fantastic. Over 70% of the teachers have more than 3 years of experience, so they're very senior. And yet, that school has single-digit proficiencies, meaning less than 10% of the kids can read and do math at the grade level. That's crazy. Now, a mile from that school is a parochial school, non-public, that charges parents $7,000 a year, and it's one of the best schools in all of Delaware. So how is it possible that we can spend $32,000 a year in a public school and fail, $7,000 in a parochial school and have wonderful success? It's not a money problem. So to me, it's very simple. We need to get the state and the federal government out of the classroom. The state and the federal government are telling the teacher too prescriptively exactly what to teach, exactly how to teach, exactly when to teach, and the teachers have lost control. Teachers have 30 different students in their classroom with 30 different learning styles. They know how to teach their kids. And yet they're being told, in one case I heard, you have 15 minutes a week to teach science, and that's all. You may not teach more, and yet it's going to be on the test at the end of the year, the statewide test, the federal test. That's unacceptable to me, that the teachers have lost control. So to me, the solution is relatively easy. It's give teachers back control of their class, let them determine how to teach, what to teach, and ultimately they'll be rewarded or punished by the testing at the end, and give the parents control and choice. And the choice to me is exactly what you say. The voucher system would be tremendous, letting parents go from poorly performing public schools to some great private and parochial schools.
Well, you said it's not a money issue, yet $7,000 to go to that private school is a lot of money for the average individual. However, if some of the tax monies that he's paying to the public system can be kept and put into that system, we may see a change. And then, in turn, the public school systems, to compete, may say, we got to change things. We got to do it differently than we're doing it now. Let's talk about that money issue again. You said that the public schools, we may be contributing $20-some thousand for each individual student to work in that school, when at the private schools we're paying less to allow them to learn the same subjects and possibly learn them better, according to statistics that have shown that private individual schools have better outcomes. How can we even make that discrepancy come to an even plateau or even playing field?
Well, what I find really interesting is, imagine for a second that we did have a voucher system and we had expanded school choice. We have limited school choice now, but the reality is if you're living in Wilmington, you have the choice between 3 bad schools that you can't get to with busing anyway, probably. And so it's not real choice. So imagine we had expanded choice, where now, instead of spending $22,000, or in this case, $32,000 on that student in Wilmington, the state then has to give a voucher to a parent for $7,000. The state has just saved $21,000, over $20,000 on that student. by giving that voucher. And the student's getting better education in the process. And it's relieving pressure in the classroom because the teacher has less students they have to teach, so that the teacher-to-student ratio is improved. Benefit after benefit happens. And it frees up the school system to pay more money to the teachers instead of more money to the admin. Right now, in the last 3 years, administrative costs have gone up and administrative salaries have gone up by 54%. Teacher salaries have gone up by 4%.
Another thing, teacher salaries should be raised.
Teacher salaries need to go up.
Right.
So imagine a voucher system that allows some of that pressure to come off the public schools, and say 20% of the kids go to private and parochial, and now the public school system, A, has to get better, but B, has the resources to get better.
In your opinion, why hasn't this happened? Why haven't they looked at this and said, ooh, let's try the voucher system, for example?
We have tremendous resistance among the legislature here in the state and among the DSCA, the teachers union.
Why?
Why? I don't quite understand it, but I was talking to the teachers union recently, and I was asking for their endorsement, and as soon as I said school choice, they said, sorry, we can't support you. And I think they're afraid that it will impact teachers negatively, and that teachers who have seniority might be let go because they're not teaching well. Well, you know what? If you're not teaching your student well, maybe you should be let go.
Mm-hmm.
So market forces are good here. We should think about education as a business in the state, and the product we're producing is the students. And if we're not producing good product, let's change the manufacturing process.
Gotcha. Okay, I think it's time for a little break here. This is Dr. Nick Biasotto. I'm interviewing Eric Hansen, a candidate for the United States Senate, and we'll be back in a moment.
Information about the Medical Society of Delaware can be found on our website, medicalsocietyofdelaware.org. Questions about our podcast can be emailed to healthcare.reality@medsocdel.org. That's medsocdel.org. Once again, here's Dr. Nick Biasotto.
Okay, this is Dr. Nick Biasotto. We're back from our break in our questioning Eric Hansen, a candidate for the United States Senate. We've talked on some very good and very interesting issues. Now on a very controversial one facing us in America today, and that's the Dobbs Act. After the Supreme Court struck down Roe versus Wade, and this seems to mean that the U.S. government is opposed to abortion as a federal issue, and what the court did was simply to turn the issue over to the states and let the people decide. I think they went and moved in that direction because there's nothing in the Constitution, them being the constitutionalists that they are, that had anything to say about abortion. Wasn't known about that point in time, I imagine. What are your thoughts on this whole issue?
Yeah, so like it or not, you're exactly right. Like it or not, Dobbs did push the decision back down to Delaware, and as a federal candidate, as your next U.S. Senator, I would never override the will of the people here in Delaware. Delaware's been pretty clear about where it stands on abortion rights, and I would never overrule the will of the people here and vote for a federal abortion ban as a U.S. Senator. So let me just reiterate, I will not vote for a federal abortion ban as a U.S. Senator.
Well, I think that's reasonable to let the people decide. And if the people in each state decide, they decide what they want. Is there a limited time of abortion? Are there special circumstances allowing abortion? If the women in each state really feel strongly about their bodies and their ability to make that decision between them and their doctor, they'll go to the voting booths and vote for it or against it or do whatever they have to do. Okay. Thank you. Our veterans now. This is something that is sad, in my opinion. Should our government do more to support veterans, many of whom are homeless, living on the streets, and suffering from physical or mental conditions from their service? Many of our vets and first responders have died in the service of our country. Yet the present government seems to want to give support to the millions of migrants who enter illegally over those who have sacrificed in our defense, some suffering the ultimate sacrifice, their lives. Presently, many nonprofits, such as the Tunnel to Towers, have picked up the baton and have supported the families of service members. Should the government do more? How can we give our brave soldiers and first responders their due?
I love this question, and the answer is yes. Vets have put their lives on the line for us in many cases, and they should be a priority for us as a country. Eric Hansen was the Secretary of the VA from 2009 to 2014. He had on his agenda to get to zero homelessness for veterans, and they made tremendous progress. We are now at essentially zero functional homelessness, which means those who don't want to be homeless are largely can get vouchers to pay for rental or for housing costs.
And that's government vouchers.
Those are government vouchers.
Okay.
So that's great.
Mm-hmm.
Unfortunately, we still have two problems with that. One is there are not additional services beyond those housing vouchers to help them with food or utilities or other services. And to your point, we have essentially functionally zero homelessness right now with the vouchers coming to the vets, which is fantastic. But that's only for housing. What we're not getting are the wraparound services. So the food, help with food or help with utilities. That's being taken up. The slack is being taken up by nonprofits that are jumping in to fill those voids. That doesn't always exist for every vet and in every community. So it would be great if the VA had more support to either get some of those services taken care of by more nonprofits or to step in when those nonprofits are not able to. The other piece of that is we talked about the functional homelessness being zero, but then we have the involuntary homelessness, the people who don't even want to be homed, the people who have so many mental health issues that they're on the street and they have a hard time getting off the street. In that case, we, again, need the VA to step in and do more. Part of what the VA needs help with is resources to get more mental health providers like psychiatrists, which they really struggle to hire and retain psychiatrists in the VA. So more help getting VA psychiatrists would help with mental health, not just for the homeless, but for VAs in general, which is desperately needed. Another thing that we should do is, for the vets, is Vet Choice. It's a tremendous program that allows vets to go outside of the network as they need to get service outside of the VA network. The problem with that program is, in many cases, the vet ends up getting the bill for those services. And then the vet doesn't know what to do and sometimes gets them into financial trouble. The VA needs to take those bills so they never hit the vet. And that is a program that I'd like to see put in place. And then we have tremendous bureaucracy in the VA that needs to get addressed. It literally takes an act of Congress, quite literally, to build a new hospital or a new large clinic for the VA. It shouldn't be that complicated. Now, fortunately, we have the Senator Elizabeth Vet Reform Bill. It's actually known as the Senator Elizabeth Dole 21st Century Veterans Healthcare and Benefits Improvement Act, a mouthful. But it's a wonderful act that simplifies and improves access and efficiency of the VA programs. I love it. We have to pass it. Then the very last thing I'll say is you're right. First responders as well. We owe a debt to first responders and to the police, and we need to end the war on police. So it's not just vets, but it's the first responders and police as well. Okay.
And you touched on it briefly, mental illness. That's a problem outside of veterans, too. We have a poor mental, we poorly address our mentally ill, and that is the area where a lot of crime can be prevented if we really got more serious about the mental illness that we face in America today. In 2007, I was chairman of a task force by Terry Spence, who was the Speaker of the House at the time, on issues to resolve these mental issues. What we need to do in Delaware to improve our care for our mentally ill. I don't think it really ever got addressed. And, I had a table full of psychiatrists, primary care doctors, internists, psychologists who told us what the problems were. I simply listed those problems and discussed them and sent them on down to Dover. That was overlooked. So I think it didn't have a big fiscal note, but the answer I got back for why wasn't any of this addressed is that it had a fiscal note. Well, what's that mean? I mean, do we care more about, how much it's going to cost and in the long run save it in the end? Never got answered, never got done. So I hope people are listening and do something about this and take this seriously because it's a problem. Okay. I'm a big bugaboo about the family unit. This is the cornerstone of a thriving nation and an economy. At present, the American dream seems to be a pipe dream. Can we remedy the problem with good, sound economic changes, improvement in the family unit, hopefully see that fathers step up to the plate if they participate in the making of a baby, and take care of the child with the mother in a household that can lead the child in the right direction? That's a real open question, but do what you can with it.
Sure. What I can say, again, having gone up and down the state and talked to a lot of folks, is parents are concerned greatly because they always had a hope that the American dream would be true for them and their kids, and the kids would have a better life than them. And they're really questioning now whether their kids will have a better life. And even more worrying is the kids are really concerned that they aren't going to have as good a life as their parents. And that's really something we have to be concerned about. I think the answer is smaller government and free the market to really thrive, and that's ultimately going to allow more jobs, higher paying jobs, the private sector to get more involved and to thrive as well. Nonprofits, we got to take the shackles, the government shackles, off both the private sector and the nonprofits, and that will do great things to allow these barriers to success to be removed, which right now we're creating the barriers. America is the greatest country on earth. We have the ability for that American dream to come true. We're creating barriers, and the government is creating barriers unnecessarily that make it harder for people to succeed. Affordable housing's got to get tackled. Education, as we already talked, is a huge limiter for us. Government waste is a problem. If we just spend our money more wisely as a country, all of these problems or many of these problems can get solved.
Some of these pork barrel things that they put money up for is just totally ridiculous. Somebody wants an Olympic pool up the top of this building or something. Outlandish requests by individuals in Congress and Senate. That should just be totally put down and gotten rid of so that money can be put in use in better ways.
To your point, let's get rid of the Olympic-sized swimming pool and do more mental health services.
There you go. Okay. Do you support a strong military? As it said, strong military is a deterrent to war and an advocate for peace. What do you think?
Couldn't agree with you more. And there's really nothing more critical to the safety and security of our country than our military, and bless all their hearts. The problem we have with the military right now, I think, is the contracting processes from the 50s. And I heard stories about a young, nimble startup that had technology that was ready to go, something that the U.S. government, the military, wanted to buy, but the contracting process made it so difficult for them to go to this startup, which had product on the shelf ready to be sold to them, and they had to go to one of the big military contractors and had that product developed and took years and cost 3 times more. That's just a fundamental problem we have with contracting that's got to get fixed. But in addition, the military, I think, should move from, just like the contracting is old school, move from old school technologies and keep advancing. That's what we're so good at, keep advancing on autonomous and smart and drones and all of these new technologies are doing tremendous things to keep our service members safer, but to give us military edge. That's exactly what we need to do in the military.
Okay. What's your feeling about artificial intelligence? I mean, is it going to influence us in a good way? Is it possibly detrimental to individuals? Is our privacy going away? What's your thoughts?
So the answer is yes to all of those.
Okay.
It's all true. AI can be a tremendous enabler, and we need to keep investing in AI, and we need to be the world leaders in AI as we are right now, because it's tremendous technology and could be a tremendous economic driver as well. Back to the military, AI could allow us to do surgical precision military with AI and smart and other technologies. So what I don't want to see happen, though, is that the government tends to step in and overregulate, and the government can never keep pace with technology. We innovate so quickly in this country, the government's just never going to be able to keep pace. So let's have good principles that help us go the right direction and protect all of us in a way at a very high-level, principle-based level, but will release the private sector to do what's necessary to really develop the technology as quickly as possible. Otherwise, other countries like China are going to catch up to us and surpass us.
True. I think it was, who was it? It was Isaac Asimov, I think, wrote about robots and how there were 3 rules for the robots. I mean, one of those rules is don't infringe, don't do any injury to a human being, and the other 2 rules followed suit. That's how I looked at AI and said, it could be scary, I guess.
No, but I think you make a really good point, which is those rules from Asimov were the kind of thing the government should create.
Yeah, exactly.
And the government shouldn't try and regulate at such a micro scale that they lose their way.
Got it. All right, lastly, as a pet peeve of mine, has to do with what I mentioned earlier about Dr. Burnout. This is, or that is, the insurer's demand to control the doctor-patient relationship through prior authorization systems, which cost the average physician and the payers millions of dollars on an issue that has placed unnecessary burdens on physicians and has delayed services to patients and in some cases have led to bad outcomes. What is your stance on this issue? It's probably a broad issue, but what is your stance? We have tried to make it easier at the state level. The AMA is constantly fighting a battle over it. We tried to make it easy at our state level. It's still the same. The control of the insurance company over the doctors, which has produced burnout and in some ways bankruptcy for doctors to continue in practice. How do you feel about prior auths? Have you ever had any personal experience in that realm?
Yeah, so I think it's exactly the right question, and it's really important. Prior authorizations are used to save insurance companies money. They're not used to help the patient. They're not used to help the doctor. It's just to save the insurance company money. And just like I've said in so many other topics, we need to strip away the bureaucracy. And that's true not just for the federal government, but for the insurance companies as well. The doctor knows best. The doctor knows how to treat the patient. And so in my mind, we should shift very quickly from where we are now, pre-authorizations, to trust but verify. Mm-hmm. And the burden should be on the insurer to prove that the treatment is unnecessary and not on what's happening right now. The burden right now is on the doctor and the patient to prove that the treatment is needed. So let's shift that burden away from the doctor and the patient and put it on the insurance company. Trust but verify. Doctor, you're going to do what you think is right, and if your track record is terrible, we'll come back on the back end to try and course correct. But you, the doctor, should be able to do what's right for your patient.
I agree, and some programs have tried to do that by giving gold cards to certain doctors who are good utilizers, and I guess there are a few doctors, and not a whole lot, that overutilize. They order MRIs for, a nosebleed. I mean, come on. That, I understand, is an issue, but if they track this, they should know who overutilizes and who does it right, and should just, maybe educate the ones ordering too many tests that it's not necessary and why. Another thing about prior authorizations is the cost. It's very costly. I don't see how they're saving any money. Insurance companies, it costs them a lot to continue to monitor, and it costs the physician a lot to have his staff constantly fighting to get a process approved. And then when it's denied, the doctor gets, in 99% of the time, gets on the line, talks to a peer-to-peer, and it's approved. After about a week of trying, the staff trying to do it, the doctor finally settles the problem. Okay. Well, I think this has been a very interesting interview. I would just like to let the audience know that we have now interviewed the Republican candidate for the U.S. Senate and the independent candidate from the U.S. Senate. We have asked the Democratic candidate for the U.S. Senate to come in if she would so desire, and we have not heard back from her staff. Okay, this is Nick Biasotto, finishing up the podcast. Nice talking with Eric Hansen, Republican candidate for the U.S. Senate. Okay, this is the Medical Society's Delaware Healthcare Reality podcast. Today's guest was Eric Hansen, Republican candidate for the U.S. Senate. And thank you, Eric, for being here. It's been an interesting conversation.
Dr. Biasotto, thank you so much. This has been a real pleasure.
You're great. Thank you.
This has been Delaware Healthcare Reality, a podcast presentation of the Medical Society of Delaware. For more information about MSD, visit our website, medicalsocietyofdelaware.org. For questions or suggestions regarding our podcast, email us at healthcare.reality@medsocdel.org. Thanks to audionautics.com for our music. Delaware Healthcare Reality is produced by Tom Mitten. I'm Lori Ann Rhodes. Watch for our next podcast episode. Until then, be well. The Medical Society of Delaware, MSD, is providing this podcast for informational purposes only. It provides neither medical, legal, nor any other professional advice. The views, thoughts, and opinions expressed by the host or any guests are their own and do not reflect the views or policies of MSD. Unless specifically stated, reference to any specific product, service, or entity does not constitute an endorsement or recommendation by MSD. Reliance on the information provided in this podcast is exclusively at the risk of the listener. MSD expressly disclaims any and all liability or responsibility for any direct, indirect, incidental, or other damages arising out of any individual's use of, reference to, or reliance on this podcast or the information presented in this podcast.